Before we dive deep into really understanding bipolar disorder, let's understand mental disorders in general. A mental disorder typically needs to have the 4 Ds: deviance, distress, dysfunction, and danger. Now, deviance is that it means that the person is acting or thinking or feeling different than those considered normal in our place and time. So this has to do with societal norms and culture. Distress is that the behaviors, ideas, or emotions have to cause some kind of distress. They interfere with how you see yourself and make it so that you feel maybe worse than you would if you did not have a mental disorder. Dysfunction means that it interferes with daily functioning. And danger means that it places the person or those around them at risk. And this may not be an immediate risk, but this could be a risk for really any kind of physical harm, like if a person has depression, they might not brush their teeth, and that could cause harm because then they could have cavities, things like that. So it's not necessarily danger like violent danger, but it can be. But it's also some of the non immediate dangers that happen. There are a ton of categories in the DSM 5, which is the Diagnostic Statistic Manual, 5th edition. I'm going to cover just a couple of them here today, but here are some of the examples. There's neurodevelopmental disorders, psychotic disorders, mood disorders, which is where bipolar fits in, anxiety disorders, obsessive compulsive and related disorders that moved to a new category in the DSM 5. Trauma and stress related disorders, dissociative, personality, and substance related and addictive disorders. So let's talk a little bit about mood disorders before we really dive deep into bipolar. Mood disorders impact a person's emotional state. These are things like depression, bipolar disorder, and dysthymia. Some other symptoms that might occur besides just depression, mania, and feeling irritability for more than 2 years is feeling like worthlessness, having suicidal thoughts and behaviors, racing thoughts, trouble with sleep, appetite changes, either eating too much or not eating enough, very poor concentration, fatigue, and low self-esteem. Anxiety disorders involve more than temporary fear or worry. Some symptoms include persistent and excessive worry, panic attacks, fear of social situations, fear of abandonment, phobias for different things. Like I have this phobia of cows for some reason. Don't ask why, because I don't know either. And also some physical symptoms like heart palpitations, sweating, feeling fatigued or restless. And some of the types of anxiety disorders are things like generalized anxiety disorder, panic disorder, social anxiety disorder, agoraphobia, and separation anxiety. And in another video, we're going to dive deep into generalized anxiety disorder because it is often a comorbid disorder with bipolar, which means that it is diagnosed in addition to having bipolar disorder. Personality disorders are long-lasting disruptive patterns of thinking, behavior, and mood, and relating to others. There's 3 clusters of personality disorders. The first one is paranoid, schizoid, and schizotypal personality disorders. Cluster B is the ones that we kind of talk about more, like antisocial, borderline, and narcissistic. And then cluster C is avoidant, dependent, and obsessive compulsive. And we'll talk a lot about borderline in another video because not only is it comorbid with bipolar disorder on occasion, It is often confused with bipolar disorder. Many people who are not aware of what bipolar disorder is often think that people who show signs of borderline personality disorder are bipolar, and they are very different conditions. Neurodevelopmental disorders. These are disorders that affect the brain and neurological symptoms, causing impairments in functioning, and they often start in childhood. One that is often co-diagnosed or comorbid with bipolar disorder is ADHD. Then there's also autism spectrum disorder, learning disabilities, speech disorders, and Tourette's. These are all considered neurodevelopmental disorders.